mommies and daddies, and welcome to a brand new season of 9 Months Season 5. The only show dedicated to parenting, the mother of all responsibilities, no pun intended. Well, this season, we're going to discuss the most exciting part of that parenting journey, beginning with your pregnancy through your child's infancy. Pregnancy is a unique life-altering journey that brings immense joy and excitement in a woman's life. As a mother-to-be, you do everything to protect your unborn kid. An important part of this is getting vaccinated during pregnancy. Now, vaccination during pregnancy is an extremely valuable intervention, not only to protect the mother, but also to provide immunity to newborns against serious diseases like tetanus, diphtheria, and pertussis. So it's really important to consult your gynecologist about these 3-in-1 vaccinations during your pregnancy, which not only helps protect you from 3 serious diseases, but also helps protect your baby in the first few weeks of his or her life. Now, why is this important? This is because your baby's vaccination will only start from 6 to 8 weeks of age, and all the other while, your baby is susceptible to diseases like whooping cough, which can lead to hospitalization, and that's something you do not want for your newborn. So go ahead and talk to your gynecologist about the 3-in-1 vaccination during pregnancy that helps protect your newborn from these 3 serious diseases. We have some very interesting guests on our show today to discuss all this and more. With a master's in nutrition and dietetics, she understands what it takes for mothers to stay healthy. She's a leading voice on public health and nutrition and is a well-known author, podcaster, and media presenter. Please welcome to the show, Swati Batwal. You've seen this lovely mom light up the screen, and now she's here to share with all of us about what makes her tick. Please welcome Prachi Shah. She's a popular television and film actor, and she's also a Kathak dancer. She holds the Guinness World Record for 93 spins in a minute. Right in the beginning of the show, I spoke about the importance of vaccination during pregnancy. And on 9 months, we're all about separating fact from fiction, so you can make the right choice for yourself and for your baby. Here to shed some more light on women's health during pregnancy and the importance of vaccination, we have Dr. Rishma Dhillon Pai. Dr. Rishma Dhillon Pai is the president of the Mumbai Obstetrics and Gynecological Society. She's also a consultant gynecologist at some of the city's largest hospitals like Leelavati, Jaslock, and Hinduja hospitals. And it's a great privilege to have her on the show with us today. Hi everyone and welcome. Thank you so much for joining me here on 9 Months Season 5. It's a complete pleasure having all of you. Okay, now I want to get to, all of us as parents, we have our own personal style of how we kind of bring up our kids. I understand Rishma, that you don't yet have a kid, but I think eventually you would have a kid if you felt like it. I just want to ask you, what do you think is your parenting style? I'm going to give you a whole lot of options, and all of you can tell me what your parenting style is. Is your parenting style the timetable mother? Is it, the I'm your friend mother? You're the nutritionist mom? Are you the exercise mom? Are you the playful mom? My way or the highway mom? Or are you the indulgent mom? So if you could just tell me what is your style from here. I'm going to start with you, Rishna.
I would call myself a balanced mom and 1:1 kind of a mom. Try to be, equally, because my children are a little bit older. So try to raise them as, almost like equals. Not when they were very little, but after that, I think always try to give a ear to what they have to say and try to be very balanced and neutral. Yeah.
Oh, that's lovely. I'm going to go with Prachi. Prachi, what kind of a mom are you?
Well, out of the options you've given, I am the timetable mom and I am the exercise mom. And she hates it. Talk about it. It's just, and now that I'm at home, like through the lockdown, it's even getting like tougher on her. But yeah, I'm quite the time management kind of a mom.
Maria, I'm going to choose active mom because I think the child will be surrounded around nutrition. in my situation. So I think a child has to be really active to stay fit and healthy. So I want to inculcate that. So I think I'm going to go for that option of active mom.
Okay, that's fantastic. Thank you. Thank you for that. Okay, I'm going to start off straight away with Dr. Pai. You know, at the beginning of the show, actually, we were talking about vaccinations. So, could you throw some light on that?
Yeah, let's begin by saying that vaccinations are investment in health. Vaccines have been there for many years, but typically we associated it with children. You know, when the children are newborn and in the first few years, we are constantly vaccinating them against this and that. But vaccinations are required through your entire lifetime, from childhood up until old age. And nowadays, just like everything else, medicine has become more advanced, technology has become more advanced, and more combination vaccines are coming in. And so the person doesn't have to go that many times for repeated vaccination against every single disease. So we do have a couple of infections covered in one single vaccination, and that's really beneficial to the patient.
So, like you rightly said, that vaccinations, you said, are not just for kids. It is for, you can be having them for your entire life. Now, a lot of vaccinations that you do take are during your pregnancy. I just want to also ask you, what are the vaccinations a woman has to take, you know, post that or at various stages in her life? Could you throw some light on those vaccinations as well?
Yeah, so basically, we like to ideally see a patient even before she plans her pregnancy. So if a girl comes to me when she's young, we would suggest to her that she takes the human papilloma virus, HPV vaccine, which is now very popular, protects you against cervical cancer, vaginal, vulval cancers, etc. So we would do that. We would protect her against hepatitis B, if required, hepatitis A, chicken pox, a lot of conditions if they were to come earlier. Measles, mumps, rubella, we would protect her against a lot of things so that when she comes pregnant to us, she's already protected against the common infectious conditions. But if that doesn't happen, suppose she comes to us straight away in pregnancy, then there are two vaccines which are really crucial in pregnancy. One of which most of you are familiar with, the TT, tetanus toxoid injection. But now, in fact, even the government last 2 years has gradually phased out TT to make a combination vaccine suggestion, that is TD, tetanus and diphtheria. And now we even have the 3-in-1 vaccine, which has become famous as triple protection against tetanus, diphtheria, as well as pertussis. Pertussis is commonly called whooping cough. So, that is quite a common condition, especially in India. There are 30,000 cases every year, and it can be actually a life-threatening condition in certain situations. And so this triple vaccine also is now given in pregnancy. And another vaccine which was not very popular earlier, but now is being strongly recommended by all organizations, that is the flu vaccine, the influenza vaccine in pregnancy. Because in pregnancy, pregnancy is a very delicate situation. Immunity is sometimes a little down. And in this, if we can protect the mother, we get a dual benefit. We, of course, protect the mother, and we can also protect her baby and the newborn.
Okay, Swati, I'm going to go with you and I'm going to ask you. You start with, the conception of your child. And then, of course, you go through the 9 months and then you give birth to your kid. And then your life just changes. It goes 360 and it does another 360. I just want to ask you, Swati, what is the kind of nutrition, what is the kind of, preparedness you need to have? You need to prepare your body. How do you do that? And how do you change your diet along the way, to sustain you through?
Yeah, thanks for asking that question, Maria, because I think maternal nutrition plays such an important role in both a child's health and a mother's health as well. I think to begin with, I think overall pregnancy has got a big impact psychologically as well. So I suggest mothers to be like in the right frame of your mind, get ready for pregnancy. If you're looking at prenatal nutrition, then there's certain nutrients which are like really important. I would definitely say start with folic acid. If you're not able to meet the requirements of folic acid through food, which are a lot in green leafy vegetables, then you can start a supplement as recommended by a gynecologist. And making sure your vitamin D levels. In India, we are really low in vitamin D and vitamin B12. These two are really important sources of energy, and vitamin D is very important for the bone health as well, and overall well-being of a mother. When it comes to getting into the nutrition while they are pregnant in the first few weeks, women, there's a big notion. They think that it's like, we have to eat for two.
Yeah.
It's basically you don't have to eat for two. Babies are very clever. They get all the nutrients out of mothers. So don't worry about weight gain. It's okay. It's only when you get into the second trimester that's where you need to worry a little bit more about weight gain. As long as the fetus weight is okay, you do not have to worry about it. Looking at food safety, mayonnaise, has got raw eggs in it, so make sure you do not use raw mayonnaise. Aged cheese, like yellow cheese, they are okay. But if you have any white cheese, you have to be like really careful. And also making sure if you're having any salads and sprouts, make sure they are at home. And sprouts can be cooked as well. Follow all the practices of food hygiene. They are really, really important. But remember, every pregnancy is beautiful. It's very individual. Not every pregnancy is going to be the same. So, just listen to your body, listen to your body's demands, and more than anything else, just make sure that you are happy. Just enjoy this moment of pregnancy.
Okay, that's fantastic. Thank you for that. Dr. Rishma, I just want to ask you, during these very uncertain times when, at the moment, you do not want to be going out too much, you definitely do not want to be getting into hospitals too much. What are the precautions, a pregnant woman can take, to guard herself against the diseases that she's commonly susceptible to?
I agree with you completely. These are very, very difficult times in this COVID-19 pandemic. And we have also, in a way, changed the way we practice. We are consulting the patient a lot on the phone. So telephone consultations are going on. We've reduced the number of visits of a patient. Normally, they would come to see us 8 or 10 times in their pregnancy. We reduced that to about 4 or 5 visits maximum. And we try to do as much during one visit as is possible. So we try to give the vaccination one time. For example, if she comes in after her 27th week of pregnancy, which is, the third half of pregnancy. So we can give her the 3-in-1 vaccine and the flu vaccine at the same time. So in one visit, she gets vaccinated against 2. Also, our clinics have changed. We work only strictly on appointments. Most of the reports are sent up ahead, so we have already got the patient's reports before she comes to see us. So the interaction time is minimum. Our clinics now have sanitizers. We give them masks. We keep distancing. There are hardly any patients in the clinic at one time. We don't allow older people or children to accompany the patient. And of course, like I said, visits are minimized and a lot of telephonic consultations are done. So this way, we've made the whole antenatal phase quite safe. And of course, we try to deliver them as quickly and safely as possible and send them home early so that then they can be nicely isolated and safe in their homes.
Thank you so much, Dr. Pai. As you highlighted, Doc, you were talking about how vaccines are important for the pregnant mom as well as for her unborn child. Now, how important are these vaccinations during every pregnancy? Can you just elaborate on this for us?
See, most people believe that vaccines are for the mother, and they are. The vaccines have a multiple benefit to the mother and to the baby. So, of course, if she takes a medicine for the vaccination, for example, tetanus, diphtheria, pertussis, the 3-in-1 vaccine, it protects her from all these infections. And if the mother is well, the baby is well. But also, the antibodies which are produced go through the placenta into the baby, and they protect the baby from getting infected soon after birth also. So normally the vaccinations start after 1.5 months, 6 months, later after the baby's born. So these, especially pertussis, happens in the first 6 weeks of the newborn's life. And this vaccine protects the baby once it's born before it gets its own vaccination. So also the flu vaccine, if the mother is given the flu vaccine, the antibodies go through the placenta into the baby. And for the first 6 months, the baby is also protected from the influenza or the flu. There's also something called cocooning. We advise that not only the mother, but even the surrounding, the grandparents, the father, whoever is looking after the baby, if all of them are given the triple vaccine about 15 days before the birth of the baby, all of them will be protected from the infection, and they won't be able to pass it to the baby. So the baby is cocooned and protected nicely against all these 3 infections.
I love this idea of cocooning, and I think that is something that has not yet been told to pregnant women.
Yes. And also one thing you mentioned, sorry, I forgot to add, about every pregnancy. And that is true, that this particular vaccine, the 3-in-1, should be taken in every pregnancy because the antibodies are highest when the vaccine is taken, and they will pass through the placenta into the baby only when you take it in that pregnancy. So even if you had a baby 3 years earlier and you had your vaccine then, in your next or current pregnancy, you should take it again, typically between 27 to 36 weeks of pregnancy.
That's wonderful. Thank you so much for this, Doc. That was very, very insightful. Pregnancy and parenting are great experiences. But you know what? They bring about so many doubts. And when it comes to doubts, it's just better to talk it out. That's what we're here for. Okay, ladies, it's time to reveal your motherhood quirks in a special mommy edition of Never Have I Ever. So if you have done what I read out from my cue card, don't forget to raise your hand, okay? Oh, this way. Okay, so did you guys ever sit down and imagine, so this is what my baby is going to look like before you all, had your baby? While you were pregnant?
I have.
Yeah, you did?
I have completely, and she has turned out to be exactly the way I had imagined. It was actually overwhelming and scary in a way because in my husband's family, in their entire 7 generations, they've never had a girl, and they wanted a girl, and I was very sure it's a girl, and I was very sure she's with fair skin and dimples and brown eyes and golden hair, and that's exactly the way she was when she was born. And I was shit scared when I saw her, and the doctor actually told me that it's a girl and she's got dimples. And because I had a word with him before I went in, and I said, "Listen, this is what it is, and this is what I mean." Throughout, he knew my journey, and this was so nice. I mean, this is something that I talk about it and share with all my friends. That this
That's
is the
so
way it was, and
nice.
this is the way I've imagined. Yeah, and that's exactly the way she was. Is rather, yeah.
So sweet. Dr. Rushna?
No, actually, I have really no imagination of what my child would be like. But it's a lot easier for today's mothers because the 3-dimensional sonography, 3D and 4D we do nowadays, you can
Yes.
actually see your baby almost exactly like it's going to be, with the cheek, with just everything, with the hand where it is, and so you can
It's
literally see
very
your baby.
cute.
I didn't have that when my children were born, so yeah, I miss that.
Who actually same here. I don't remember seeing any of these kind of sonographies. I mean, we could see, but not that clear. I mean,
The 3D,
what
4D,
A
exactly
3D,
like
yeah, a 3D 4D is very good. So I must tell you that I went completely wrong with what I imagined my baby to be. Firstly, I thought I'm going to give birth to a baby girl, and it turned out to be a baby boy. So that's what it was. And after having a baby boy, I was like, oh my God, baby boys are so much of fun. Till I had my baby girl, and I was like, oh my God, baby girls are the best. So yeah, that's how it was. So never ever have I let peer pressure affect my parenting decisions.
yeah, in my case, there was that little peer pressure because my parents, I was with my mom, and they had this strange notion about that the baby can't be in a diaper the first 3 months. And I'm like, okay, that makes my life like really tough. Just
Hell.
simply because with the Bombay temperatures, and you're going to develop skin rashes, and that's not the way it's going to be. And AC is not good for the baby. I'm like 20,000 points there, and but I still being the obedient child did listen to my mom and dad for quite a bit. Um, but yeah, after the third month, I think I pulled along pretty well because they were really stressful nights and days. I mean, can you imagine the child without a diaper, and you're constantly, the child is just peeing and etc etc, and yeah. So I think, yeah, absolutely, like you also rightly said, if you just things are much easier. It's just that we are probably stuck onto a lot of these old generation, which are,
Yeah.
to some extent pretty right. I'm not denying that. But yeah, I feel we need to move on and work around what's happening today and make the best out of the facilities that we've been allowed to work on.
Right. So you're pregnant. You've done everything right for 9 long months. But now it's time to prepare yourself for the birth. Now that requires some special planning. Well, our next panel discusses that very topic, getting ready for childbirth. What kind of mental makeup should you have when you know you're going to deliver now in a month, in a few days, and you have to get make your ride to that hospital. A hospital, you have to do the right kind of breathing. You have to stay calm. How do you prepare for all of that? Could you just throw some light on this?
I think it's all about preparation, mental and physical. If the patient, all through the pregnancy, has been told about what to expect, she's educated about it, well informed, maybe she has joined some classes for breathing, for pelvic floor relaxation. She's been told, and she has a partner with her who helps her, to prepare for the labor contractions, etc. Then the patient goes in knowledgeable. She knows her lamas, she knows everything. And patients nowadays don't require to bring much to the hospital. When they come to the hospital, I tell them just carry your basic toiletries, carry a comfortable pair of slippers, maybe a feeding bra, maybe your sanitary pads if you want. But other than that, nothing very very specific they require. And main thing is to have a good birthing companion with you, to be well informed, and to go into it as a very natural, normal process. And have faith in your doctor who will be there to guide you throughout, to tell you how you're progressing, and to sort of smoothly flow through the entire thing without getting into stress.
Wow. I think that's a lot. That's a wonderful, piece of advice. Is the first thing is that you have to trust your doctor. Don't listen to anyone else. Just trust your doctor, because I think that's where half your problems will get solved. But, I just want to say thank you for joining us today on 9 months. It was a lovely conversation. It was very heavy on childbirth and delivery and vaccines, which is all a very, very important part of this entire journey. And thank you, everyone, for your input. I just want to leave you with this lovely hamper from the Moms Co. I hope you have this.
Thank you for this. Thank you so much.
Thanks for this.
A lovely hamper from the Moms Co., India's largest Nature In, Toxins Out brand. Well, you've got some lovely products in there, including the Moms Co. Natural Baby Wash, which is a lovely wash for your babies, which is clinically tested, tear-free. It's also soap-free and has mild coconut-based cleansers, organic aloe vera and avocado oil that gently cleanses your baby's skin. Thank you, and I hope you really, really enjoy it. It's sent to you with a lot of love. Thank you. Parenting is such an amazing ride that you have to give in and enjoy it. You, of course, need to take certain precautions, like getting the right vaccinations and the right nutrition on time, especially through the early years. But once you know your child is secure from within, we say, to use a roller coaster analogy one last time, just hold on tight and have a lot of fun. In fact, a lot of screaming fun. Thank you so much for joining us on 9 months, season 5. See you soon.